Okay. Now coming to the functions of WHO. So this is the mnemonic which we have to remember. B, C, D, E, F, P, H, 2. Okay. 8 functions, and this is the mnemonic. B, C, D, E, F, P, H, 2. So B for क्या हो सकता है बताओ? Biomedical research. C for बताओ चलो. I'll deal with each one by one. Biomedical research. C for?
Cooperation with other organization.
Yes, Marunisa, very good. Cooperation with other organizations. D for?
Development of comprehensive health services.
Yes, development of comprehensive health services. E for? Environmental. F for? Family health. P for prevention and control of specific diseases. And H for? We were discussing the broad areas of work of WHO.
Health literature.
Health?
Literature.
Yes, health literature. And one more H. Health statistics. Okay. So this is the mnemonic to remember the 8 functions of WHO. So I'll tell you each one by one. So first coming to biomedical research. So this particular question, functions of WHO, this also came as a short note in the semester exam of Calcutta National Medical College this year. So, okay. So coming to biomedical research. So WHO, as such, they do not conduct research directly, but they stimulate and coordinate global research. How do they do that? They provide aids, they give fundings, they also have their own journals where widely acclaimed PubMed index journals where one can publish their good research. It has a worldwide network of WHO collaborating centers. It also provides grants and research and institutions to promote health research. So if anybody anybody proposes a research which they think is quite good and will get great results, so they will even give grants to those researchers. Regional Advisory Committee define regional research priorities. So, as we know, there are 6 regions. I will discuss that also. There are 6 regions of WHO. So, according to that region, they have the priority listed that with the health statistics which we get. This enables the WHO to identify the priority areas in the particular WHO regions. So accordingly, for each region, there are research priorities set. So if any researcher, if when they open their grant proposal, so if any researcher in that particular field, they propose a research which entices them and they think that it is good enough, then they will also fund it. A global advisory committee addresses global health research policies. So there's a advisory committee which will oversee all these things, and the special program for research and training in tropical diseases is there, which targets 6 major diseases, which is malaria, schistosomiasis, trypanosomiasis, filariasis, leishmaniasis, and leprosy. So this is a special program catering to these 6 special diseases. Basically, the objective is to develop new tools, strengthen research institutions, and train workers in affected regions. Okay, so if they have good workforce, they can better deliver their uh, policies or what. the thing they are planning to do in that particular region. So they even train the people working at the grassroots level. Okay. So this is the biomedical research. They will fund the projects. They will have priorities, health priorities set for different WHO regions. They have special programs for research and training going on for the six major diseases, as I had said. And there is a global advisory committee which oversees all this. They also have their own journals, uh, which are very globally very acclaimed journals. Okay. So the second was B हो गया biomedical research. C was cooperation with other organizations. So WHO collaborates closely with the other United Nations and its specialized agencies. It maintains various levels of working relationships with these organizations. It also has established partnerships with several international government organizations. So now nobody can work alone. So they have to have cooperation and coordination with other organizations which are basically working in the same area. Like UNICEF, they are focused for children and women, which is also a key audience for WHO. So they have many of the programs which are running in collaboration. So that is why C is cooperation with the other organizations. Okay. Then was D. B is biomedical research, C is cooperation with other organizations, D is development of comprehensive health services. So WHO's most important function is to promote and support national health policy development. Okay, so once the problem is identified, one needs to develop the policies to combat the problem. So its aim is to help countries build comprehensive health programs. Okay, so the key areas include organize health systems based on PHC, so that if the person is treated at the primary health care itself, they need not come to the tertiary care center. So less load on the tertiary care centers, less out of pocket expenditure for the person who is coming to the PHC. Developing and utilizing health manpower, training the staff, making them better, so that the many of the services. For many of the services, the person or the person living in the village, they don't even have to come to the PHC. Most of it is being catered to at their household itself, or the anganwadis or the nearby schools, primary schools itself. So developing and utilizing health manpower, building long term national capacity, especially infrastructure and management. If we need to deliver these services, we need to have a good infrastructure and management services in order to oversee it. And if there are any fallbacks to rectify it, so that is why building a long-term national capacity, and monitoring, evaluation, and health services research. Since all these things are going on, we need monitoring and evaluation. After monitoring, if something is not once the person monitors the program and then goes for the evaluation, and if they're seeing that it is something is falling back or something is short, they come they how to put it, they come back to make it proper. So health service research and all these are the key areas for development of comprehensive health services. WHO launched the appropriate technology for health program to promote self sufficiency in addressing health problems. Okay, so this program was launched by WHO, and the ATH program supports and strengthens the primary healthcare initiatives, which is the appropriate technology for health. So B is done biomedical research, C is coordination with other agencies, D is development of comprehensive health services. E, B, C, D. Now coming to E, which is environmental health. So environmental health promotion has always been a key WHO activity. It advises governments on national sanitary services programs. Main areas include again air, water, food quality protection, occupational hazard and safety, detection of new technological health hazards, and radiation protection. New technology. Anybody can tell me any new technological health hazard? And there is a very recent WHO advisory which has come for it.
Ma'am, for screen viewing.
Yes, screen time. So now an advisory has come to limit the screen time used for children who are below 2 years of age. So detection of new technological health hazards. Then major initiatives include WHO Environment Health Criteria Program and WHO Environmental Health Monitoring Program. So these are the major initiatives which under the environmental health. Basically, its overall aim is to improve global environmental health standards, so a person has comfortable living, so they are product economically, socially, mentally, physically, in all ways they are productive to their nation and their country. Now coming to F, family health. Family health is also been a very major part of WHO program. So for family, it will include everything, whoever is in the family, basically maternal and child care, mother and the child, human reproduction, as we were studying the unmet need of pregnancy, nutrition and health education. Health education in the form of tobacco chewing, cigarette smoking, nutrition as in what to feed the infant and young child who is below 2 years of age, what to feed the adults, and what foods which are nutritious food, which easily available nutritious food which can be used by the family without burning a hole in their pockets. So family health deals with all this, and the main goal is to improve the quality of the life of the family as a unit. Okay, so if the family, if as we have there is a quote, uh, a healthy mind can a healthy body can harbor a healthy mind. So physical and mental health, both of them go hand in hand. So again, if even one member in the family is suffering from a disease or anything, is suffering from any mental or physical ailment, the entire family suffers from indirectly suffers from it. So if a family is healthy and both physically, mentally and socially, so they can obviously have better offsprings who are better able to cater to their own needs as well as that of the society. Okay, so family health. After that, B, C, D, E, F. Now what comes? What P? P for
Prevention and control of specific diseases.
yes, prevention and control of specific diseases. So WHO has worked on most of the communicable diseases globally. So it conducts epidemiological surveillance via the international health regulations, the ATRS. Can anybody tell me the full form of ATRS?
Appropriate
Appropriate
technology research services.
alert and response system?
Sorry, ma'am.
No, no.
Actually,
Tell me.
ATS আগের স্লাইডে ATS ছিল, আমি ভাবলাম ওরকম কিছু হবে।
No, no, ঠিক আছে. So basically, WHO has a global mechanism for detecting, verifying, and responding to public health events and outbreaks. Okay, so it collects information from various surveillance networks, ensures rapid assessment of any potential threats which might be there in a country, which might spread globally. So any organization which works for it, outbreak response, global outbreak, any idea? Go on. Anybody has heard of GOARN? Anybody knows the full form? Global Outbreak Alert and Response Network. So basically, the World Health Organization, it coordinates responses to outbreaks under this. So basically, this particular organization, they deal with the outbreaks and at an international or the global level, and they also help in the response to it, like giving aids or medical aids or staff if one at the ground at the ground level, if a medical staff is needed. So basically, the Global Outbreak Alert and Response Network, they inform WHO about the epidemics which might turn into pandemics. So it works in according uh, in alignment or in coordination with Goan in order to prevent and control many of the diseases. So it also provides aid through WHO emergency scheme for epidemics. In whichever country, if there is an epidemic occurring, it will provide scheme to them, whoever are the members. And IHR also aim to prevent disease spread and with minimal disruption to travel and trade. So they will have their advisories going on the quarantine or on the isolation, and how many days one needs to be, what all precaution one needs to take. so that trade and travel is minimally disrupted, because in today's global economy, we depend on trade and travel a lot. So if even for one day, if it is stopped, it leads to loss in a lot of money globally. So, and WHO also addresses the NCDs like cancer, diabetes, heart diseases, or the mental illnesses like depression and anxiety. It works in, again, vector control, immunology, drug quality, lab technology, etc., and also runs the expanded program on immunization for childhood vaccines. So this is all these all activities are under the prevention and control of specific diseases. Okay. Next was H, health statistics. So since 1947, the WHO has collected many of the information on morbidity and mortality profile of various countries. So the data was published in weekly epidemiological record, World Health Statistics quarterly, and World Health Statistics annually. So weekly, quarterly, and annually. Quarterly as in 3 months, 1 quarter. Okay. So the current data can be obtained from the chief statistician at WHO Geneva, which is the headquarters. So to ensure international comparability, WHO issues the ICD, which is revised every 10 years. So the latest ICD, which is ICD 11, has been published in 2022. Okay. So this is how the health statistics is maintained, and their uniformity across all the nations is ensured. So WHO, they also assist in improving medical record system and developing national health information systems. So if any country needs aid in the form of technology or money, so they also assist those countries in that. So this is the health statistics. You have to remember that data in the by WHO is published weekly, quarterly, and annually. Okay. WER, weekly epidemiological record, then World Health Statistics, one quarterly and one annually. Okay, and ICD, it also issues the ICD. So latest ICD is ICD 11, published in 2022. Health statistics. So as Maronisa was saying, health literature and information. So basically, WHO acts as a clearinghouse for global health information. As I was saying, it publishes numerous titles and papers on various health topics. It has many of its journals. It also has many of the region-based journal. There is a WHOCR South. There is a dedicated journal for the Southeast Asian region, in which India also falls. So it has. It also has a indexing, its own indexing system, which is the MEDLARS. It is a computerized international indexing system, which is managed by the US National Library of Medicine. So WHO Library is a satellite center of it, and it also maintains public information service at its headquarters in all 6 regional offices. I was saying the health statistics data, which is given weekly, quarterly, and weekly, quarterly, and annually. So all these data are maintained, and whatever publications, as it also aids in biomedical research, as I was talking about, it gives aids or grants. So whatever publications are there, it also helps in imparting that information across the globe through its journals and indexing sites. Okay, so there are the 8 functions of WHO are clear, and I think the mnemonic is also fine. You'll be able to remember it and write it.
Yes, ma'am.
Okay. I think you can understand ना health statistics and health literature में क्या difference है, दोनों में क्या अलग अलग लिखना है. I can't see you people.
Yes, ma'am.
Health statistics, health literature में confusion नहीं होगा ना, you can write different. ठीक है. Even if you don't remember this medlars and all, you don't have to remember the name. Just write there are dedicated regional journals. There are particular indexing sites. So this is how it promotes the dissemination of information which it collects through its health statistics. So the functions of WHO are done till here. Any questions so far?